Hi, this is Frank with a Frank Opinion. Before I start today's video, I just want to say that I'm dedicating it to four wonderful people: Lisa, Lori, Hope, and Susan. And I think you know who you are. A couple of days ago, I reacted rather angrily to a Facebook post that talked about an article in which our senior senator from New York, minority leader of the Senate, Chuck Schumer, said that he could not embrace Bernie Sanders' Medicare for All single-payer bill that the Senator Sanders had just introduced. That he wanted to look at other bills before he endorsed or embraced it. And I reacted angrily to that, and I said that this was an example of malfeasance, dereliction of duty, and uncaring political crassness. And I'm going to try to explain why I used such strong language. In terms of malfeasance, some of the synonyms, adjectives are dereliction of duty, breach of trust, malpractice. And the reason why I chose that particular word is that Senator Schumer has been senator since 1999. He's been chairman of the Senate Democratic Policy Committee from 2011 to 2017. Vice Chair of the Senate Democratic Caucus from 2007 to 2017, and as you know, he's Minority Leader in the Senate now. And he has been part of a political system that has seen wage and income inequality grow by leaps and bounds since the late 1970s. Has been there for half of that period. And actually, there's at least two more articles today, one in the New York Times, that indicates that income and wealth disparity and inequality actually started 10 years before we thought that it really took off. So he's been there a long time. At the same time, over the last 8 years, going into 9 years, we've been talking about nothing else but repeal and replace healthcare as one of the top three domestic issues in the United States. And we complain about the Republicans not having a plan, having so many attempts in so many years to come up with their repeal and replace, but forget that the Democrats and Senator Schumer, as part of that, a very important part, allowed the ACA with no improvement to keep 29 million people uninsured, millions more uninsured, underinsured, hundreds of thousands of Americans dying each year for lack of coverage, not access, coverage, which is the most important word we can use with regard to health care. And during that time, there have been at least 20 studies, some by the Congressional Budget Office, by the GAO, Government Accounting Office, 3 that were made by national think tanks, at least 15 state surveys and research papers on Medicare for All single-payer universal health care, all, including the governmental ones, indicating that the only way to cover everybody, the only way to reduce cost, the only way to make sense of our health care fiasco is by going universal health care single payer. The reason for single payer is that we can build on Medicare, which is a single payer program. Not a socialist model necessarily, which is the Veterans Administration. Big difference. Socialist medicine, government owns the providers, government pays. We already have that. Veterans are very happy with that. Medicare, seniors above the age of 65, ecstatic about that, don't want to lose it. So we have a system in place that costs a fraction of what the for-profit insurance system that we use here in the United States, multi-payer, and we've known that since 1991 with the CBO study and now throughout all these years. In addition to that, we have reams of books coming out talking about this in great detail, with many, if not hundreds of examples of Americans going through hell trying to deal with insurance adjusters and people that are designed to make sure that either your payment is delayed so they can float the money and invest it, or that they don't pay you at all. Some of these, a more recent one, An American Sickness, How Healthcare Became Big Business and How You Can Take It Back by Elizabeth Rosenthal, 2017. She's been on many, many shows talking about her book. America's Bitter Pill, wonderful. By the way, read that one, read this one. America's Bitter Pill, Money, Politics, Backroom Deals, and the Fight to Break Our Healthcare System, written by Stephen Brill in 2015. Fantastic. I've got it. The Healing of America, A Global Quest for Better, Cheaper, and Fairer Healthcare by T.R. Reid, 2009. Well, guess what? Frank is reading it now. I've gone through the system in Japan, in Germany, in England, and let me tell you that they are happy as punch with their universal healthcare systems. And they all save money. It's 40% less, if not more, than what we spend here in the United States for a system that leaves 15 to 20% of Americans uninsured and underinsured, that leaves people sick and bankrupt year in and year out, that causes incredible stress, that our healthcare indices in terms of infant mortality, healthy age after 60, meaning how many years you're going to live after that in a healthy way, and even our longevity with regard to white working class Americans has gone down. Unprecedented. Chuck Schumer has been there through all of this and has had all this time to bone up, to become well versed in health care. He's got lots of staff. I use the word crass, uncaring political crassness. And the word crass, among other things, says guided by materialistic values, insensitive, thoughtless. Well, there may be reasons for why that happens. I looked up on Open Secrets, one of the many sites where you can get public information on donations to elected officials and other things. And guess what? Over the last 5 or 6 years, from 2011 to 2016, Senator Schumer came in number 2 in private equity and investments companies' donations to his campaigns. Number 2. Hedge funds, number 2. It may be the reason for why, as I sat next to him in a meeting, he couldn't recall being talked to by Carl Levin's staff with regard to S-268, which dealt with, among other things, the carried interest loophole, which benefits private equity and hedge fund managers. Number 2. In terms of general securities investments, number 2. Of the top 10 senators getting donations from these 3 sectors, there's only one senator that beat him, and that was Republican Rubio, and only one other Democrat in the top 10, Michael Bennet from Colorado. Kind of a very small list of Democrats in that top 10 list. I must tell you that, in my opinion, I wonder why we are scared of Charles Schumer. We have to change him around, and what I would suggest is this, that there be formed by an appropriate organization a 3-month plan to get him to endorse Bernie Sanders' Medicare for All bill, or an equivalent, if one comes up, if one exists now. 3 months. He is the New York State Senator, U.S. Senator, representing New York State, which is the epicenter for wealth and income inequality in the United States. He is representing New York State, which supposedly is a more liberal, advanced, progressive state. He is representing New York State, who is trying to, for the last number of years, create their own universal healthcare system called Healthcare Act. And by the way, The number of endorsers in terms of labor unions, you can't read this, I understand that. The list is hundreds of labor unions, progressive organizations, community groups, medical professional associations, etc. I'm going to post this on my site, on my page, so that you can look at the hundreds of organizations endorsing. They represent New York. You also have organizations like NYPAN, New York Progressive Action Network, and others that can take this cause, starting very politely and ratcheting it up relentlessly until Charles Schumer does the right thing. And Charles Schumer endorses a Medicare for All single-payer program. Idea, a fantasy of mine actually. Charles Schumer has 8 offices around New York State. And he's got his Washington office. I fantasize about simultaneous meetings and or demonstrations in front of those 8 offices, presenting information, books, and all those reports and studies that I shared with you that say that universal health care, Medicare for all single payer, is the way to go, the humane way to go, the fiscally prudent way to go, the only way to control health costs and cover everybody. Why are we afraid of Chuck Schumer? I don't think we have to be. Thanks.